So today's topic is lung cancer, and you guys already did the pre-test, so we'll do a post-test at the end and see kind of how, hopefully you learned some things. So this is just my background. I did my medical school at University of South Florida. I did my training at Texas A&M at Baylor Scott & White in Texas near Austin. And I've been at Holzer for 4.5 years now. So just a little bit kind of to start out with, this is kind of what we're going to be talking about. So in general, I'm going to tell you about lung cancer, what it is, how common it is, some of the risk factors, the two major types. We're going to go into some of the anatomy as well as how to prevent lung cancer. So that's kind of the big thing, is I want to teach about prevention as much as we can, and the lung cancer screening guidelines. That's another way that we can kind of look at preventing further stage or further advanced cancers from forming. And then at the end, we'll do a little quiz again. So what is lung cancer? So lung cancer is a cancer that forms in the lungs. Lung cancer in general is good cells that have gone bad. So those cells that are in our body, they're constantly changing and dividing, and the DNA in certain cells goes bad, and our immune system usually takes care of that. But in some cases, the cancer cells can kind of grow out of control, and that's when we have to intervene. So to understand lung cancer, the things we want to talk about is the anatomy of the lung, so that you can understand a little bit more about lung cancer. So in the lung, there's two sponge-like organs, and they're kind of divided into different lobes of the lung. When you breathe in, air comes in through your mouth, goes in through the windpipe, splits into your right and left lung, and you exchange air that way. The trachea divides into two tubes. Those are known as the bronchi, and those are divided into branches called bronchioles. And at the end of the bronchioles are tiny air sacs known as alveoli. The alveoli are these small areas that absorb the oxygen. The oxygen goes in into the blood and comes out as the carbon dioxide. The carbon dioxide is expelled every time you breathe, exhale. So does anyone know how common lung cancer is, or can you think of, is it kind of a more common cancer or a rare cancer? What do you guys think?
More common.
More common, good. And how deadly do you think it is? Do you think it's one of the more deadly cancers, or one of the more treatable cancers that patients live a long time? Deadly, that's right. Unfortunately, yes. So it's actually the second most common cancer among men and women. So in men, prostate cancer is number 1, lung cancer is number 2. In women, breast cancer is number 1, and lung cancer is number 2. So it's very, very common, and we see it a lot. It accounts for 25% of all cancers. Lung cancer mainly occurs in older people, and of course in smokers, there's a much higher chance. Lung cancer is the leading cause of death in cancer among both men and women. So unfortunately, it's very deadly. And it accounts for 1 in 4 cancer deaths per year. The two major types of lung cancer are small cell and non-small cell lung cancer. Non-small cell is the more common type. It's 80 to 85% of all cancers. And if a lung cancer has a characteristic, it can also be mixed. So it can be a non-small cell and a small cell, although that's pretty rare. As you all know, smoking is the leading cause of lung cancer, but there are a lot of other causes. 80% of lung cancer deaths are attributed to smoking, and many other causes are from secondhand smoke. So that's actually also very concerning when people have secondhand smoke. A small percentage of lung cancers are attributed to no risk factors, and we don't know why. Patients that have never smoked in their life can sometimes still get a lung cancer, and that is alarming, but usually there's some other, maybe some other risk factor or genetics playing a part. Risk factors in general are anything that increases or decreases the risk of a person getting a disease. So that's what kind of the definition of a risk factor is. And there are many known risk factors for lung cancer. Some of these can't be changed, but some can. So that's kind of what I want to focus on, is the things that we can change. Tobacco smoke, of course, is the leading risk factor for lung cancer. Cigar smoke and pipe smoking is also a risk factor as well. The longer you smoke, the more packs per year you smoke, the higher the risk of the lung cancer. Low tar or light cigarettes, some people think that those are safer or less likely to cause kind of carcinogenic, but they're just as bad. And menthol cigarettes can also increase the risk even more because you tend to take a deeper breath, and those are actually, I think they're even more addictive. So menthol cigarettes are bad too. One thing that I think a lot of people don't understand is that once you stop smoking, your body recovers fairly quickly, and you can actually breathe better, decrease your risk of cancers from smoking. So the longer you go without smoking, kind of the better that chance is. So some patients don't understand that, like, once they've stopped, it kind of decreases their risk. They think, well, we can continue to, smoke and the risk will still be there, or if I quit, then, nothing's going to change. But it actually does recover fairly quickly, the lungs do. Secondhand smoke, a lot of people say, well, I never smoked in my life, but I was around a ton of smokers. My entire family smoked, or my husband or my wife smoked. Well, that does increase the risk quite a bit. So that's something that we kind of need to educate our patients on, is that, that is very concerning, especially if it's over 20 or 30 years, and patients are just constantly inhaling that smoke, and even as a child inhaling that smoke. Another thing that kind of is popular amongst young people is hookah smoking. Hookah is also linked to lung cancer. It does have kind of toxic chemicals in it, and people tend to inhale it longer, and so that increases the risk of lung cancer as well. Radon is another thing that is naturally, it's a radioactive chemical that's naturally occurring. It's mainly found in basements, and it's something that can't be seen, tasted, or smelled, so it's kind of a scary thing because you don't know it's there, but it can constantly be there and cause the cancer. According to the US EPA, radon is the second leading cause of lung cancer. So that's something that can be kind of found in non-smokers. Asbestos, which we've seen quite a few patients, that have asbestos exposure, that also increases the risk of lung cancer. And if somebody is smoking and has asbestos use, their risk is even higher than kind of the two combined if you were to just look at each risk factor. Arsenic is also found in drinking water and can be linked to lung cancer as well, especially in smokers. And there's a lot of other kind of workplace-related chemicals that can lead to lung cancer and cancers in general, so those are listed here. But in our area of the country, coal is one of the big ones. A lot of the power plants and things, they do increase the risk of cancers in general, and diesel exhaust is another one. So what can you do to prevent lung cancer? So there's no kind of sure way to prevent lung cancer, but we know that there are things we can do. Number one being stopping smoking. Other things we can do to kind of prevent them from being found too late. So the best way for people to kind of reduce their risk of lung cancer is to not smoke at all. Avoid breathing other people's smokes, as secondhand smoke. And reduce or eliminate radon exposure. So we talked about, radon being in basements and not being something that anybody can sense, but that if you, kind of look out for it or try to spend time away from a place where radon is prevalent, then you decrease your risk of lung cancer. Following a healthy diet, avoiding those known cancer-causing chemicals that we talked about. So the good news is that there is a screening for lung cancer, so that's really exciting that over the last few years, this low-dose CT screening is kind of a new way to find cancers a lot earlier, because the problem with lung cancer and a lot of cancers is patients don't realize that they're having a cancer until it's far too late. So, they start having trouble breathing or chest pain, or they find it somehow incidentally, but it's already a stage 3 or stage 4. So we really want to catch these as soon as we can in a stage 1 or 2 where they're curable. So it used to be that we'd hardly ever see patients in those stages, but now with low-dose CT screening, that's becoming a lot easier and more common. So kind of the idea behind low-dose CT screening and screening for lung cancer is that we find patients that are high risk enough that would probably pop up with nodules or early stage cancers, and then you would be able to follow them and eventually treat them if needed. So this guideline has been changing lately, but kind of the general rule is that patients that are older, so 50 to 80 is usually the age that they're recommending the screening for, and then patients that have smoked more than 15 packs 15 pack years. If they have quit within the last 15 years, then usually they qualify. One of the guidelines said 20 pack years, one of them said 15. But in general, it's usually the patients between 50 and 80, and once they start screening, they should get their screening every year. So that's one thing that I recommend everybody talk to their primary care physician about. That way they know who qualifies. And luckily at Holzer we do have a grant, and I think you've told us that it's $100 out of pocket, or sometimes that can even be comped if your insurance doesn't cover it. And if you qualify, then you would be able to get this low-dose CT screening and potentially find a cancer way earlier. The low-dose CT screening does have to be done in a special facility, so Holzer does have that. It has to be a special type of scan. It's called a low-dose scan, and we have to have the right type of radiologist to be able to read those scans, so we do have that here, which is great. So what patients need to know is that if you fit all the criteria, you can talk to your healthcare provider about this. It's important to find out if your health insurance will cover it, and I talked about that. We could probably help with that as well. So why does it help to get screened? I guess the main thing is that we want to find these cancers early. So in a stage 1 or a stage 2, those are potentially curable cancers. It's cost effective. So just like when everybody knows that you have to go for your mammograms, it's the same cost effectiveness to get this test done as it is a mammogram. So it makes sense cost-wise, because treating a stage 3 or stage 4 is much more expensive for everyone and obviously could be deadly. So what patients need to know is how to decide, talk to their physician. Once they've reached 80, they can usually stop, or they can kind of keep watching with their primary, and make sure it's a facility that actually is trained to do the low-dose CT and has it available. Of course, screening is not an alternative to not smoking. You want to quit smoking and keep screening. So we do recommend that everybody quits. Some people who get lung cancer have no risk factors. We talked about that the best way to kind of decrease that risk is to avoid smoking in general. Do you guys have any questions so far? I kind of went through it quickly, but.
What about vaping?
What's that? Vaping? Yeah, so vaping, it does increase your risk, but we don't know how much. And, it's a different type of kind of toxin. There are studies that show that it can damage the lungs. Long-term, since it's kind of new, we still don't know the long-term effects, but it can also damage the heart. I don't really recommend it, but if a patient had to choose between the two, then maybe the vaping might be a little bit better. Probably not much, but the best thing to do is try to get them to quit completely. The best luck we've had is, just kind of counseling them. There's a 1-800-QUIT line number. You can give them tobacco supplements like patches or gum or different things to kind of curb the cravings. And then if they're really motivated, they'll do it. So it's tough. It's tough to actually get them to, but yeah, vaping is it still has its own risks for sure. Any other questions before we do the quiz, the post-test?
How much exposure do you have to the radon?
I think it's over years, so it's just like any other, risk factor for cancer. It's not just going to happen when you're exposed to it once, but if you're, let's say, living in a basement, or you're living in a house that has a basement that has that exposure over years and years, it could increase the risk. But I think it's the number 2 cause in non-smokers.
I've heard a lot of homes are it's one of the requirements when you're selling your home now.
Right, they have to check for it, so that's good. That's good that it's kind of incorporated now. Asbestos is another one that's in homes, that sometimes people don't know about. Yeah, with this.
There's a detector now.
Yeah, there may be a detector like a carbon monoxide like that, like similar to that. Yeah.
What about our power plant workers?
Yeah.
Like if they do not smoke and they don't have any, predisposition to lung cancer, but
right.
They've worked their careers in. When should they start getting screened, or how does that work? If they
I think that's one of those where it's not in the guidelines for the low-dose screening, but if a patient were to talk to their primary and they had that risk factor, it's worth getting tested, especially if they're having any kind of symptoms, like if they're having shortness of breath or anything. But yeah, that is a high risk factor in this area, and a lot of our patients that don't smoke still get lung cancer, and it's probably linked to something in the area. So we do recommend that they still talk to their primary and then make sure it's covered. If it's not, I think we could probably work on getting it covered or paying for part of it so that it would be covered. But yeah. definitely. Any other questions? Okay, we'll do the post-test. So the first question was, if you've never smoked, you don't need to worry about lung cancer. So is that true or false? False. Good. So although smoking is the #1 cause, we know that there's patients who get lung cancer that have never smoked. There are things we talked about, radon, secondhand smoke. So a lot of people say, well, I didn't smoke, but then when you get further, you know that they have been exposed to a lot of cigarette smoke. So that is a very common one. We talked about the other chemical exposures as well. Oh. Go ahead and fill that out first, sorry.
What is cheat?
Yeah. Hopefully we'll get the first one right. Hopefully I reviewed it all. Okay, so we did the first question. The second one, there's nothing people can do to decrease their chance of getting lung cancer. Is that true or false? False, right. Can you name any of the things people can do to decrease their risk?
To stop smoking.
#1, right, good. So quit smoking, minimize all the other exposures we talked about, definitely. The lung damage that leads to cancer can be repaired by quitting smoking. Very true, good. So actually 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. So it's fairly quickly. 1 to 9 months after quitting, coughing and shortness of breath decrease. And 10 years after quitting, the risk of dying from lung cancer is about half. So it's pretty amazing how quickly the lungs can recover, even in an older patient. Replacing cigarettes with spit tobacco or snuff is a safe way to decrease lung cancer risk. I didn't really go over the specific thing, but do you think that's true or false?
False.
Right. So it will probably decrease some of the risk of lung cancer, but it leads to a lot of other cancers. So it can lead to esophageal, mouth cancer, stomach cancer, pancreatic cancer. So, and mouth cancer is very directly linked to that and is very devastating because it usually requires surgery and it can leave the patient with a lot of problems. So the last question, or I think there's 2 more. Lung cancer is one of the deadliest cancers. True or false? Good. It's the #1 cause of death. It's worse than colon, breast, and prostate combined. So it's really, really deadly, unfortunately. Lung cancer often doesn't cause problems until it's too late to cure it. Is that true or false?
False.
It's true. So it usually doesn't cause symptoms right away. So like if somebody has, a nodule or a small mass, they may never know it's there until it gets big enough to know it's there. So, it kind of, a lot of times it'll present like a pneumonia, but it has to be big enough to even cause those symptoms. So yeah, that's usually why we try to find it early with the low-dose CT screening, because if it's a tiny little nodule, the patient will have no clue it's there. It's just going to be found on imaging, and that's when you want to find it because you can easily remove it or treat it with radiation and cure it. And then do you guys remember kind of the screening guidelines? So some of them say 55 to 75, some say 50 to 80, but patients around the 50 to 80 range is when we start screening for lung cancer. And it's patients that have smoked for a long time. Some say 20, some say 30 pack year, have had to quit in the last 15 years if they've quit. But for those patients doing the testing, the low-dose CT screening early is the best way to find it. They may have negative tests at first, but then as things go along and they keep checking every year, that's when they find them early, and then we can easily treat them.
When it says 20 pack year,
Yes.
is that
The pack
of cigarettes or the
Yeah. So one
Dad
pack.
smoked 2 packs a day.
Right. So a lot of people smoke like 1 or 2 packs a day. So if they smoked 15 years, 1 pack per day, that's 15 pack years.
Oh,
If they
okay.
smoke 2 packs per day for 15 years, they're 30 pack years. So yeah, so a lot of people would qualify even over a shorter period of time if they're smoking 2 packs per day. Yeah, so the amount of cigarettes matters too. Yeah. Yeah. And so we try to, do our best to convince patients that it's not worth the cost and the, because it's a significant cost to patients and it's not worth the health, downsides of the health risks later on. Because we know that cigarettes not only increase your risk of lung cancer, but all cancers. So most of our patients we see are smokers. So any other questions you guys have? I'm glad you guys learned everything.
The low dose of the CT,
Yeah.
that doesn't maximize your risk of getting a different type of cancer, right?
Right. So it's so low that it is very, very rare to cause another cancer, and that would be many, many years down the line. So, the chance, like we get radiation from anything, so that low dose is so low that it's not going to do anything. And the risks are so low compared to the benefit of finding a cancer that is going to actually could spread.
Are the results instantaneous, like same day, or do you read them later?
Usually, I think it's a day or so. I'm not the radiologist, but depending on how busy they are, usually a day or two. So yeah, it's pretty quick. Yeah,
I
yeah.
was going to ask Nicole, do we have grant funding still?
Yes.
for
That's what I was asking her. She said, yeah, we do. Because we actually just saw some other hospitals in the area are providing that service, and I was making sure that we still have it. And I think ours is actually cheaper, so that's good. Yeah.
And we do here, definitely St. Athens, correct?
Yeah, so that's great. So yeah, I mean, I think awareness, like making sure all the primary care providers know, patients that don't see primary care, we have to kind of alert them so that they can hopefully still come and get that done. But we do.
To get a low dose CT, like how far is that? Like if I needed one tomorrow, how long would I have to wait? Or
Do you know, Nicole, how long?
Usually I get you in pretty quick. Yeah,
Within like a week or
quick.
two, right? Yeah, pretty quick, yeah. And do you know, like, if patients don't technically qualify, is there a way to say, get them to qualify? Like, are there exceptions or anything? Like, if they, like she said, like with patients that have high risk?
It's only for smoking.
Okay.
Ones that have quit smoking
Right,
or
right,
currently
the
smoking.
specific criteria, yeah.
The other things like power plants and stuff like that, the radiologist would probably recommend a regular CAT scan.
Right,
um,
right,
To see if there's anything going on.
right.
But yeah, this is strictly just
Smokers,
nicotine.
yeah. Any other questions? Okay.
Once somebody starts with so let's say it's been 10 years since they quit smoking.
Right.
Once you reach that, it's been 15 years, do you automatically stop doing a low dose CT or do you just keep going?
We kind of tweak.
Because don't most of them have something that they find on the imaging anyways, even after they've reached that? So I feel like they still need to be followed. Like if they have one nodule that hasn't grown, but it still needs to be followed, you would probably still do it. I don't know.
We tweak the guidelines because we can. So.
And the radiologist will usually say in the report, like the
Yeah.
impression to like follow, what they recommend. So
Yeah,
maybe they'll guide that.
Radiologists would, do it forever on them, clear up until past the age of 80. So.
yeah. Yeah, which I mean, it changed from 75 to 80 recently,
Mm-hmm.
so that means that, people are living longer and they're, we have plenty of patients in their 80s that are in great health, so it's like,
Yeah.
don't really want to stop too early either, yeah.
Yeah, we try to accommodate everybody if
Right.
we can, or we'll recommend something else if not.
Yeah.
So even if it doesn't grow, then you continue, or you'll still have the spot after treatment, they just make sure that it doesn't grow or doesn't reactivate? I don't know how to.
Right, like they just keep watching it, like it'll say 8mm nodule, follow up in 1 year, and then if it's grown, then, you could get a biopsy or something
Oh,
to.
okay, so you
but
wouldn't
if
have to necessarily do anything.
you wouldn't have to do anything unless it started to look suspicious.
Okay.
And sometimes it looks suspicious right away and they'll say biopsy, like if it's a certain characteristic, like it's spiculated or it's, a certain solid appearance or whatever, then, but if it's just a little nodule, like that could be benign, then they just watch it every year. Yeah,
Much like mole or something.
Right, just like a surveillance. So this is really kind of becoming a surveillance or just a part of primary care. You just keep watching it. Yeah. Any other questions? Good questions. Thank you. Thank you so much. Thanks.